Introduction to dog health. Understanding dog health is crucial for responsible pet ownership, encompassing a holistic approach to their physical, mental, and emotional well-being. This course will equip you with the knowledge to provide optimal care, recognize signs of illness, and foster a strong, healthy bond with your canine companion. We will explore various aspects of dog health, from daily maintenance to managing specific conditions, ensuring you are prepared for different stages of your dog's life. Emphasizing preventative measures and early intervention can significantly improve a dog's quality of life and longevity. This foundational knowledge serves as the cornerstone for all subsequent learning modules. A healthy dog exhibits specific characteristics, including a shiny coat, clear eyes, good appetite, and appropriate energy levels for their age and breed. Regular observation of your dog's behavior and physical condition is paramount in detecting subtle changes that may indicate a health issue. Early detection often leads to more effective treatment outcomes and less discomfort for your pet. This introductory module sets the stage for delving into more specific health topics, providing a broad overview of what constitutes a healthy canine. Anatomy and physiology basics. Understanding the basic anatomy and physiology of dogs provides a crucial framework for comprehending their health needs and potential medical conditions. The skeletal system, composed of bones and joints, supports the body and protects vital organs, enabling movement and providing structural integrity. The muscular system works in conjunction with the skeletal system, allowing for locomotion, posture, and various bodily functions. These systems are interconnected, and issues in one can often affect the other. Knowing the major bones and muscle groups helps in identifying areas of pain or injury. The intricate design of their bodies allows for their incredible agility and strength. The internal systems, such as the digestive, respiratory, circulatory, and nervous systems, are responsible for processing food, breathing, transporting nutrients, and controlling bodily functions. The digestive system, for instance, breaks down food for energy and nutrient absorption, while the respiratory system facilitates oxygen intake and carbon dioxide expulsion. The circulatory system, powered by the heart, delivers oxygen and nutrients throughout the body. The nervous system, including the brain and spinal cord, coordinates all these functions, enabling sensory perception and response. A basic grasp of these systems helps in understanding how diseases affect the dog's overall health and how treatments work. Nutrition fundamentals for dogs. Proper nutrition is the cornerstone of a dog's health, directly impacting their energy levels, coat quality, immune system, and overall longevity. A balanced diet provides essential nutrients, including proteins, fats, carbohydrates, vitamins, and minerals in appropriate proportions. The specific nutritional requirements vary based on a dog's age, breed, activity level, and any existing health conditions. For example, puppies require more protein and calories for growth, while senior dogs may need fewer calories and joint-supporting supplements. Understanding these individual needs is vital for selecting the right food. Consulting with a veterinarian can help tailor a diet plan specific to your dog. Proteins are fundamental for muscle development, tissue repair, and enzyme production, with animal-based sources being highly digestible for dogs. Fats provide concentrated energy, support healthy skin and coat, and aid in the absorption of fat-soluble vitamins. Carbohydrates offer readily available energy and dietary fiber, which is important for digestive health. Vitamins and minerals play crucial roles in various metabolic processes, immune function, and bone health. Ensuring a diet rich in these components without excess or deficiency is key to preventing many health issues. Avoid feeding human foods that can be toxic to dogs, such as chocolate or grapes. Understanding dog food labels. Deciphering dog food labels is an essential skill for ensuring your pet receives appropriate nutrition. The ingredient list is ordered by weight, so the first few ingredients are the most abundant. Look for whole, identifiable protein sources like chicken meal or lamb as the primary ingredient, rather than vague terms like meat byproducts. Understanding the difference between meal and whole meat is also important, as meal often contains more concentrated protein. Avoid foods with excessive fillers, artificial colors, flavors, or preservatives, which offer little nutritional value and can sometimes cause allergies or digestive upset. A high-quality food will prioritize nutrient-dense ingredients. The Guaranteed Analysis section provides minimum percentages for crude protein and fat, and maximum percentages for crude fiber and moisture. These figures help you compare the nutritional content between different brands, but remember that dry matter basis calculations are often needed for accurate comparison. For instance, a wet food with 10% protein might have a higher dry matter protein content than a dry kibble with 25% protein due to the difference in moisture. Understanding these percentages allows you to make informed decisions about caloric density and nutrient levels. Always check for an AAFCO statement, which indicates the food meets nutritional standards for a specific life stage, such as complete and balanced for adult maintenance or for growth and reproduction. Common canine diseases. Part 1. Canine distemper is a serious and highly contagious viral disease affecting a dog's respiratory, gastrointestinal, and nervous systems. Symptoms include fever, coughing, vomiting, diarrhea, and neurological signs like seizures or muscle twitching. It is often fatal, especially in puppies, making vaccination critically important for prevention. Parvovirus, another highly contagious viral disease, primarily attacks the gastrointestinal tract, leading to severe vomiting, bloody diarrhea, and dehydration. Puppies are particularly susceptible, and without aggressive treatment, it can be deadly. Both diseases spread through contact with infected animals or contaminated environments. Early diagnosis and supportive care are essential for survival. Kennel cough, a common respiratory infection, is typically caused by a combination of viruses and bacteria, resulting in a harsh, dry cough that sounds like a goose honk. While usually not life-threatening, it can be highly contagious, especially in environments where dogs congregate. Treatment often involves rest, cough suppressants, and sometimes antibiotics for secondary bacterial infections. Leptospirosis is a bacterial disease spread through contaminated water or soil, affecting the kidneys and liver. Symptoms include fever, lethargy, vomiting, and increased thirst. It can be transmitted to humans, highlighting the importance of vaccination and avoiding stagnant water sources. These diseases underscore the need for preventative care. Common canine diseases. Part 2. Rabies is a fatal viral disease affecting the central nervous system, transmissible to humans and other animals through the bite of an infected animal. Symptoms progress from behavioral changes to paralysis and death. Vaccination is mandatory in many regions and is the most effective way to prevent this devastating disease. Lyme disease, caused by bacteria transmitted by ticks, can lead to lameness, fever, and lethargy. Early detection and antibiotic treatment are crucial to prevent chronic joint pain and kidney issues. Prevention involves tick control and, in high-risk areas, vaccination. These diseases highlight the importance of both vaccination and parasite control. Canine influenza, or dog flu, is a highly contagious respiratory disease caused by specific influenza viruses. Symptoms include coughing, sneezing, fever, and nasal discharge, similar to kennel cough, but often more severe. It spreads through direct contact, airborne droplets, and contaminated objects. While most dogs recover, some can develop pneumonia. Vaccination is available and recommended for dogs at high risk, such as those frequenting kennels or dog parks. Heartworm disease, caused by parasitic worms living in the heart, lungs, and blood vessels, is transmitted by mosquitoes. Symptoms include coughing, lethargy, and difficulty breathing. Prevention with monthly medication is vital, as treatment is complex, expensive, and risky. These conditions emphasize the need for ongoing preventative care. Parasite prevention and control. Parasites, both internal and external, pose significant threats to a dog's health, causing discomfort, illness, and even death if left untreated. External parasites like fleas and ticks can cause skin irritation, allergic reactions, and transmit diseases such as Lyme disease and ehrlichiosis. Regular use of preventative treatments, including topical applications, oral medications, or collars, is crucial for controlling these pests. Environmental control, such as regular vacuuming and yard treatment, also plays a vital role in breaking the parasite life cycle. Always consult your veterinarian to determine the most effective and safe preventative measures for your specific dog and region. Internal parasites, including roundworms, hookworms, whipworms, and tapeworms, reside in the dog's gastrointestinal tract, leading to symptoms like diarrhea, vomiting, weight loss, and a dull coat. Heartworms, as discussed, are particularly dangerous, affecting the heart and lungs. Regular deworming, often starting in puppyhood, and monthly heartworm preventatives are essential for protection. Fetal examinations conducted by your veterinarian can detect the presence of intestinal worms, allowing for targeted treatment. Maintaining good hygiene, such as promptly cleaning up dog waste, helps prevent the spread of these parasites. Comprehensive parasite control is a continuous effort. Vaccinations and preventative care. Vaccinations are a cornerstone of preventative care, protecting dogs from numerous infectious and potentially fatal diseases. Core vaccines, recommended for all dogs regardless of lifestyle, typically include distemper, parvovirus, adenovirus, and rabies. These provide broad protection against highly prevalent and dangerous pathogens. Non-core vaccines, such as those for kennel cough, leptospirosis, and Lyme disease, are administered based on a dog's individual risk factors, including their environment, geographic location, and exposure to other animals. Your veterinarian will help determine the appropriate vaccination schedule for your pet, considering their age, health status, and lifestyle. Following a consistent vaccination protocol is vital for maintaining immunity. Beyond vaccinations, preventative care encompasses a range of practices designed to maintain optimal health and detect issues early. Regular veterinary checkups, typically annually for adult dogs and more frequently for puppies and seniors, allow for thorough physical examinations, blood work, and discussions about diet and lifestyle. These visits are crucial for monitoring overall health, catching subtle signs of illness before they become severe, and updating preventative treatments. Maintaining a healthy weight, providing appropriate exercise, and ensuring good dental hygiene are also integral components of a comprehensive preventative care plan. Proactive care significantly contributes to a dog's long and healthy life. First aid for dogs. Emergencies. Knowing basic first aid for dogs can be life-saving in an emergency, providing critical support until professional veterinary care is available. Common emergencies include cuts, scrapes, burns, poisoning, choking, and heat stroke. For bleeding wounds, apply direct pressure with a clean cloth. For burns, cool the area with cold water. If your dog is choking, attempt to dislodge the object using the Heimlich maneuver adapted for dogs, or by sweeping their mouth. Always prioritize your safety and approach an injured or distressed dog cautiously, as even the gentlest pet may bite out of pain or fear. Having a well-stocked pet first aid kit readily accessible is highly recommended. In cases of suspected poisoning, immediately contact your veterinarian or a pet poison control center, providing details about the ingested substance and the amount. Do not induce vomiting unless specifically instructed, as some substances can cause more harm coming back up. For heat stroke, move the dog to a cooler area, apply cool, not cold, water to their body, and offer small amounts of water to drink. Recognizing the signs of shock, such as pale gums, rapid breathing, and weakness, is also vital. In any severe emergency, the primary goal is to stabilize your dog and transport them to the nearest veterinary clinic as quickly and safely as possible. Time is often of the essence. Recognizing signs of illness. Early recognition of illness signs is paramount for prompt veterinary intervention and better outcomes for your dog. Subtle changes in behavior are often the first indicators. These can include lethargy, decreased appetite, reluctance to play, hiding, or unusual aggression or anxiety. A healthy dog typically maintains a consistent routine and demeanor, so any deviation should be noted. Observing your dog's energy levels, interaction with family members, and response to stimuli can provide valuable clues. Keep a mental or physical log of these changes to share with your veterinarian, as even minor details can be significant for diagnosis. Trust your instincts if something feels off. Physical symptoms can also signal underlying health issues. Watch for changes in eating or drinking habits, such as excessive thirst or refusal to eat. Vomiting, diarrhea, or changes in urination frequency or color are red flags. A persistent cough, difficulty breathing, limping, or swelling in any part of the body warrant immediate attention. Examine your dog's eyes, ears, nose, and gums for discharge, redness, or unusual odors. A dull coat, excessive shedding, or skin lesions can indicate skin problems or internal issues. Regularly performing a head-to-tail check can help you become familiar with your dog's normal state, making it easier to spot abnormalities. Dental health in dogs. Dental health is a critical, yet often overlooked component of a dog's overall well-being. Poor oral hygiene can lead to periodontal disease, a painful condition involving inflammation and infection of the gums and supporting structures of the teeth. This can result in tooth loss, difficulty eating, and even systemic health problems, as bacteria from the mouth can enter the bloodstream and affect organs like the heart, kidneys, and liver. Regular dental care can prevent these serious complications. Bad breath is often the first noticeable sign of dental issues, but other symptoms include reluctance to chew, pawing at the mouth, and visible tartar buildup. Establishing a routine dental care regimen is essential for your dog's long-term health. Effective dental care for dogs involves a combination of at-home practices and professional veterinary cleanings. Daily toothbrushing with dog-specific toothpaste is the most effective way to remove plaque and prevent tartar buildup. Introduce brushing gradually and make it a positive experience. Dental chews, water additives, and specialized diets can also help reduce plaque and tartar, but they are generally less effective than brushing. Regular professional dental cleanings under anesthesia, performed by a veterinarian, allow for thorough scaling, polishing, and examination of teeth and gums, addressing issues that cannot be managed at home. Your vet can recommend a schedule for these cleanings based on your dog's individual needs. Prioritizing dental health contributes significantly to a dog's comfort and longevity. Grooming and coat care. Regular grooming is more than just aesthetics. It's a vital part of maintaining a dog's health and comfort. Brushing helps remove loose fur, dirt, and debris, preventing mats and tangles, especially in long-haired breeds. It also stimulates blood circulation and distributes natural oils, promoting a healthy, shiny coat. The frequency of brushing depends on the dog's coat type, with some requiring daily attention and others needing it a few times a week. Grooming sessions also provide an excellent opportunity to check for external parasites, skin lesions, lumps, or any abnormalities that might otherwise go unnoticed. This routine interaction strengthens the bond between owner and pet. Bathing should be done as needed, using dog-specific shampoos that are gentle on their skin and coat. Overbathing can strip natural oils, leading to dry, irritated skin. Pay attention to drying your dog thoroughly, especially in areas prone to moisture retention, to prevent skin infections. Nail trimming is another crucial aspect of grooming. Overgrown nails can cause pain, affect gait, and lead to orthopedic problems. Introduce nail trimming early and make it a positive experience. Ear cleaning, particularly for dogs with floppy ears, helps prevent infections by removing wax and debris. Regular grooming ensures your dog remains clean, comfortable, and healthy, contributing significantly to their overall well-being. Exercise and mental stimulation. Regular exercise is fundamental for a dog's physical health, helping to maintain a healthy weight, strengthen muscles and bones, and support cardiovascular health. The amount and type of exercise needed vary significantly by breed, age, and individual energy levels. High-energy breeds like Border Collies require extensive daily activity, while smaller or older dogs may be content with shorter walks and gentle play. Lack of adequate exercise can lead to obesity, joint problems, and behavioral issues such as destructive chewing or excessive barking. Incorporating a variety of activities, such as walks, runs, fetch, and swimming, keeps exercise engaging and beneficial. Consistency is key to a dog's physical well-being. Mental stimulation is equally important, preventing boredom and promoting cognitive health. Dogs are intelligent animals that thrive on challenges and learning. Puzzle toys, interactive feeders, obedience training, and learning new tricks are excellent ways to engage their minds. Scent work, where dogs use their powerful sense of smell to find hidden treats or toys, is particularly enriching. A mentally stimulated dog is generally happier, better behaved, and less prone to anxiety or destructive tendencies. Combining physical exercise with mental challenges creates a well-rounded and fulfilled dog. Just like humans, dogs need both body and mind to be active to truly thrive. Behavioral health and training. A dog's behavioral health is intrinsically linked to its overall physical well-being and quality of life. Positive reinforcement training is crucial for developing a well-adjusted and obedient companion, fostering a strong bond built on trust and understanding. Early socialization, exposing puppies to various sights, sounds, people, and other animals in a controlled and positive manner, helps prevent fear and aggression issues later in life. Consistent training, using clear commands and rewards, establishes boundaries and teaches appropriate behaviors. Addressing behavioral problems proactively, rather than allowing them to escalate, is vital for a harmonious household. Patience and consistency are key elements in effective training. Common behavioral issues include excessive barking, disruptive chewing, separation anxiety, and aggression. Understanding the root cause of these behaviors, whether it's boredom, fear, lack of training, or an underlying medical condition, is the first step towards resolution. For example, separation anxiety often manifests as destructive behavior when the owner is away. Professional dog trainers or veterinary behaviorists can provide tailored strategies and guidance for complex cases. Addressing behavioral health not only improves the dog's quality of life, but also strengthens the human-animal bond, ensuring a happy and safe environment for everyone. A well-behaved dog is a joy to live with. Reproductive health and spaying-neutering. Reproductive health is a significant aspect of dog care, with decisions around breeding or spaying-neutering having long-term implications for individual dogs and the wider canine population. For dogs intended for breeding, careful consideration of genetics, health screenings, and responsible breeding practices is essential to produce healthy offspring and avoid hereditary conditions. Understanding the estrus cycle in female dogs and the reproductive physiology of male dogs is crucial for successful and ethical breeding. Breeding should only be undertaken by experienced individuals committed to the welfare of both parents and puppies. This ensures the health and temperament of future generations. Spaying for females and neutering for males are common surgical procedures that offer numerous health and behavioral benefits. Spaying eliminates the risk of uterine infections, pyometra, and mammary tumors, while neutering reduces the risk of testicular cancer and certain prostate problems. Both procedures can also mitigate undesirable behaviors, such as roaming, aggression, and marking. Furthermore, spaying and neutering play a critical role in controlling pet overpopulation, reducing the number of homeless animals. The decision to spay or neuter should be discussed with a veterinarian, considering the dog's age, breed, and individual health status. These procedures are generally safe and contribute to a longer, healthier life for most dogs. Senior dog care. As dogs age, their needs change, requiring specialized care to maintain their quality of life and manage age-related conditions. Senior dogs, typically those over 7 years old, may experience decreased energy, joint stiffness, vision and hearing loss, and cognitive decline. Regular veterinary checkups become even more crucial, often twice a year, to monitor for early signs of diseases like arthritis, kidney disease, or cancer. Early detection allows for more effective management and can significantly extend a senior dog's comfortable years. Adjustments to diet, exercise, and living environment are often necessary to accommodate their changing physical capabilities. Providing a supportive and loving environment is paramount. Dietary modifications for senior dogs often include foods lower in calories to prevent weight gain, higher in fiber for digestive health, and supplemented with ingredients like glucosamine and chondroitin for joint support. Exercise should be gentle and consistent, focusing on maintaining mobility without overexertion, such as shorter, more frequent walks. Creating a comfortable living space with orthopedic beds, ramps, and non-slick surfaces can help manage mobility issues. Mental stimulation, through puzzle toys and gentle training, remains important to keep their minds active. Understanding and addressing the unique challenges of senior dog care ensures their golden years are as comfortable and happy as possible. This dedicated attention makes a significant difference. Puppy care essentials. Bringing a new puppy home is an exciting time, but it also comes with significant responsibilities, as puppies require specialized care to ensure a healthy start in life. Proper nutrition is critical for growth and development, with puppy-specific foods providing the necessary balance of proteins, fats, and essential nutrients. A consistent feeding schedule helps with digestion and house training. Early socialization. Exposing the puppy to various sights, sounds, people, and other animals in a positive manner is crucial for developing a well-adjusted temperament. This period is formative for their future behavior and confidence. Vaccinations and deworming are also paramount during this stage to protect them from common diseases and parasites. House training requires patience and consistency, involving frequent trips outside, positive reinforcement for successful elimination, and immediate cleaning of accidents. Crate training can be an effective tool for house training and providing a safe den for the puppy. Basic obedience training, starting with simple commands like sit and stay, should begin early to establish good habits and strengthen the bond. Regular veterinary checkups are essential for monitoring growth, administering booster vaccinations, and addressing any health concerns promptly. Providing a safe, stimulating, and loving environment during puppyhood lays the foundation for a happy, healthy, and well-behaved adult dog. This early investment in their care pays dividends throughout their life. Managing chronic conditions. Managing chronic conditions in dogs requires a long-term commitment to veterinary care, medication, and lifestyle adjustments to ensure the best possible quality of life. Conditions like diabetes, kidney disease, heart disease, and epilepsy often require ongoing monitoring, specialized diets, and daily medication. Understanding the specific condition, its progression, and treatment protocols is crucial for effective management. Regular communication with your veterinarian is essential to adjust treatment plans as needed and address any new symptoms or concerns. Maintaining detailed records of medication schedules, symptoms, and vet visits can be invaluable for tracking progress and informing treatment decisions. This proactive approach helps to stabilize the condition and minimize discomfort. Lifestyle modifications play a significant role in managing chronic conditions. For example, dogs with arthritis may benefit from orthopedic beds, ramps, and controlled, low-impact exercise. Diabetic dogs require strict dietary management and insulin injections. Dogs with kidney disease often need prescription diets that reduce the workload on their kidneys. Providing a calm and predictable environment can also reduce stress, which can exacerbate some chronic conditions. While chronic conditions cannot always be cured, effective management can significantly improve a dog's comfort, mobility, and overall happiness, allowing them to live a fulfilling life despite their health challenges. Your dedication is key to their well-being. Allergies and skin conditions. Allergies and skin conditions are common ailments in dogs, causing significant discomfort and often requiring ongoing management. Environmental allergies, atopy, food allergies and flea allergy dermatitis are among the most prevalent types. Symptoms typically include intense itching, redness, inflammation, hair loss, and recurrent ear infections. Dogs may excessively lick, chew, or scratch affected areas, leading to secondary bacterial or yeast infections. Identifying the specific allergen or cause is crucial for effective treatment, which often involves a combination of medication, dietary changes, and environmental controls. Early intervention helps prevent the condition from worsening and improves the dog's comfort. Understanding triggers is vital for long-term relief. Diagnosis often involves allergy testing, elimination diets, and skin scrapings or biopsies to rule out other conditions. Treatment strategies vary, but may include antihistamines, corticosteroids, immunotherapy, allergy shots, medicated shampoos, and antibiotics for secondary infections. For food allergies, a hypoallergenic diet is essential. Flea control is paramount for flea allergy dermatitis. Regular grooming and skincare using appropriate products can also help manage symptoms and maintain skin barrier health. While allergies can be frustrating to manage, a consistent and tailored approach, guided by your veterinarian, can significantly alleviate symptoms and improve your dog's quality of life. Patience and persistence are key to finding the right solution. Orthopedic issues and joint health. Orthopedic issues affecting bones, joints, and muscles are common in dogs, particularly in certain breeds and as they age. Conditions like hip and elbow dysplasia, patellar luxation, arthritis, osteoarthritis, and cruciate ligament tears can cause pain, lameness, and reduced mobility. Recognizing signs such as limping, difficulty getting up or lying down, reluctance to jump, or changes in gait is crucial for early diagnosis. These conditions can significantly impact a dog's quality of life, making pain management and mobility support essential. Genetic predisposition plays a significant role in many orthopedic problems, highlighting the importance of responsible breeding practices. Early intervention can prevent further damage and improve comfort. Treatment for orthopedic issues varies depending on the condition's severity and type. It can range from conservative management, including pain medication, anti-inflammatory drugs, weight management, and physical therapy, to surgical intervention for more severe cases like cruciate ligament repair or total joint replacement. Supplements like glucosamine and chondroitin can support joint health. Providing a comfortable environment with orthopedic beds, ramps, and non-slip flooring can help manage mobility challenges. Regular, controlled exercise, tailored to the dog's condition, is also vital for maintaining muscle strength and joint flexibility. A comprehensive approach, guided by your veterinarian, is necessary to alleviate pain and improve mobility, ensuring your dog can enjoy an active life. Digestive health and disorders. A healthy digestive system is fundamental to a dog's overall well-being, ensuring proper nutrient absorption and waste elimination. Digestive disorders are common and can range from mild, temporary upsets to chronic, debilitating conditions. Symptoms often include vomiting, diarrhea, constipation, loss of appetite, weight loss, and abdominal pain. Common causes include dietary indiscretion, eating something inappropriate, food sensitivities, parasites, bacterial infections, and inflammatory bowel disease. Recognizing these symptoms early and identifying potential causes is crucial for prompt and effective treatment. Maintaining a consistent, high-quality diet is a primary preventative measure against many digestive issues. A balanced gut microbiome is vital for health. Treatment for digestive disorders depends on the underlying cause. For acute, mild cases, a bland diet, example, boiled chicken and rice, and temporary withholding of food may be recommended. For more severe or chronic conditions, veterinary intervention is necessary, which may involve diagnostic tests like fecal exams, blood work, and imaging. Medications such as antidiarrheals, antiemetics, probiotics, and antibiotics may be prescribed. Dietary management, including prescription gastrointestinal diets or hypoallergenic foods, is often a cornerstone of long-term treatment. Ensuring access to fresh water is always important, especially with vomiting or diarrhea, to prevent dehydration. A healthy gut contributes significantly to a dog's energy and immune function. Urinary tract health. Maintaining a healthy urinary tract is essential for a dog's overall health, as it plays a crucial role in filtering waste products from the blood and maintaining fluid balance. Urinary tract infections, UTIs, are common, especially in female dogs, and can cause discomfort and lead to more serious kidney issues if left untreated. Symptoms often include increased frequency of urination, straining to urinate, urinating in inappropriate places, blood in the urine, and excessive licking of the genital area. Other conditions like bladder stones or kidney disease can also affect the urinary system. Recognizing these signs early is important for prompt diagnosis and treatment. Providing constant access to fresh water helps promote healthy urinary function. Diagnosis of urinary tract issues typically involves urinalysis, urine culture, and sometimes imaging studies like X-rays or ultrasound to identify stones or other abnormalities. Treatment for UTIs usually involves a course of antibiotics. For bladder stones, dietary changes or surgical removal may be necessary. Kidney disease requires specific dietary management and supportive care to slow its progression. Encouraging adequate water intake is always beneficial for urinary health. Regular veterinary checkups, including routine urine tests, can help detect problems early, particularly in older dogs or those prone to recurrent issues. Proactive care and attention to symptoms are key to preventing serious complications and ensuring your dog's comfort. Eye and ear care. Proper eye and ear care are essential for a dog's sensory health and comfort, preventing infections and preserving their sight and hearing. The eyes should be clear, bright, and free of discharge, redness, or cloudiness. Any excessive tearing, squinting, poring at the eyes, or visible foreign objects warrant immediate veterinary attention. Common eye conditions include conjunctivitis, corneal ulcers, cataracts, and glaucoma. Regular, gentle cleaning around the eyes with a damp cloth can help prevent tear staining and irritation, especially in breeds prone to excessive tearing. Early detection of eye problems is crucial, as some conditions can lead to permanent vision loss if left untreated. Protecting their vision is paramount. Ears should be clean, free of odor, and without excessive wax buildup, redness, or swelling. Dogs with floppy ears or those who swim frequently are more prone to ear infections due to moisture and lack of air circulation. Signs of an ear infection include head shaking, scratching at the ears, discharge, and a foul odor. Regular ear cleaning with a veterinarian-approved solution can help prevent infections, but avoid using cotton swabs deep in the ear canal. If you suspect an infection, consult your vet for proper diagnosis and treatment. Maintaining good ear hygiene is vital for preventing discomfort and preserving hearing. Both senses are critical for a dog's interaction with their environment. Environmental hazards and toxins. Dogs are naturally curious, often exploring their environment with their mouths, which can expose them to numerous environmental hazards and toxins. Common household items like cleaning products, medications, human and pet, pesticides, and certain foods, chocolate, grates, xylitol can be highly toxic. Outdoor hazards include antifreeze, rodenticides, fertilizers, and poisonous plants. It is crucial to dog-proof your home and yard. Storing all potentially harmful substances out of reach and identifying any toxic plants. Awareness of these dangers is the first step in prevention. Always read labels and understand what is safe for your pet. A proactive approach minimizes risks significantly. Symptoms of poisoning vary widely depending on the substance ingested, but can include vomiting, diarrhea, lethargy, tremors, seizures, difficulty breathing, and collapse. If you suspect your dog has ingested a toxin, immediate action is critical. Contact your veterinarian or a pet poison control center immediately, providing as much detail as possible about the substance, amount, and time of ingestion. Do not induce vomiting or administer any home remedies without professional guidance, as some substances can cause more harm if vomited. Rapid veterinary intervention is often necessary to minimize absorption and provide supportive care. Being prepared with emergency contact numbers and a pet first aid kit can make a life-saving difference. Stress and anxiety management. Just like humans, dogs can experience stress and anxiety, which can significantly impact their physical and behavioral health. Common triggers include separation from owners, loud noises, thunderstorms, fireworks, changes in routine, new environments, or fear of strangers. Signs of stress and anxiety can manifest as excessive barking, destructive chewing, inappropriate urination or defecation, panting, trembling, hiding, or aggression. Recognizing these signs is the first step toward helping your dog cope. Chronic stress can weaken the immune system and exacerbate existing health conditions. Understanding your dog's individual triggers is crucial for effective management strategies. Managing stress and anxiety often involves a multifaceted approach. Creating a safe and predictable environment, providing consistent routines, and ensuring adequate exercise and mental stimulation can help. Desensitization and counter-conditioning techniques, guided by a professional trainer or veterinary behaviorist, can help dogs overcome specific fears. For severe cases, veterinarians may prescribe anti-anxiety medications or recommend calming supplements. Pheromone diffusers, thunder shirts, and calming music can also provide comfort. Patience, positive reinforcement, and a loving, supportive environment are essential for helping an anxious dog. Addressing their emotional well-being is as important as their physical health for a truly happy companion. Building a relationship with your vet. Establishing a strong, trusting relationship with your veterinarian is one of the most important aspects of ensuring your dog's long-term health and well-being. Your vet is your primary partner in preventative care, diagnosing illnesses, and managing chronic conditions. Open and honest communication is key. Feel free to ask questions, express concerns, and provide detailed information about your dog's behavior, diet, and any changes you observe. A good veterinarian will listen attentively, explain diagnoses and treatment options clearly, and involve you in decision-making. They are your best resource for reliable information and professional guidance. Regular visits help build this rapport over time. Beyond routine checkups, your veterinarian can offer invaluable advice on nutrition, training, behavioral issues, and age-specific care. They can also provide referrals to specialists if your dog requires advanced diagnostics or treatment. Don't hesitate to seek a second opinion. If you feel it's necessary, as a good vet will support your desire for comprehensive care. Being prepared for appointments by bringing a list of questions and observations can maximize the effectiveness of each visit. Ultimately, a collaborative relationship with your vet ensures that your dog receives the highest standard of care throughout their life, fostering a partnership dedicated to their health and happiness. This professional bond is truly invaluable.